goodbye. For a cancer patient, that word has two very different meanings. That's why when we've done everything we can, we do things nobody's done before.
I did it, Mom.
At the Christ Hospital Health Network, we collaborate with Dana-Farber Brigham Cancer Center to offer next-level care, developed by the world's best minds. Treatment that could change your odds. Or maybe the world. The Christ Hospital Health Network. Everything it takes.
The Pound This podcast is brought to you by the Christ Hospital Health Network. This is the Pound This podcast, episode 824, answering your mental health questions with Dr. Shelby Gardner.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This podcast with Amanda Valentine.
Welcome, friends, to the Pound This podcast. Before I get into this conversation with Dr. Shelby Gardner, where we actually answer all of your questions about mental health, and actually, one of the things we talk about is hormones affecting your mental health. There's a little teaser for you. But speaking of hormones, I want to tell you about my friend Sarah in Team Fit With Me. Sarah is a fantastic health coach. Whether you want to lose weight or you're looking to gain strength, you just need accountability, or you need to figure out some of your hormonal issues along with your nutrition and your physical health. Sarah can help you do those things. She has worked through this through herself. She has worked through this with hundreds of people, and they have found such great success, including myself. Working with Sarah is how I found out I had an autoimmune disease. I have Hashimoto's. Working through that. How do I eat through that? How do I move my body through that? So if you have some of those issues and you're just like, dang, I need some help, Sarah, her whole team is so great. Jess is so great. She is like the macro goddess, can help you come up with all of your meal plans, figure out what to eat, give you, hundreds of recipes, which is amazing. So again, if your goals are fat loss or whatever it is, or especially accountability or just somebody to chat to about going through this process of healthier living, Sarah is a fantastic health coach. She has reworked all of her pricing, so everything is tailored to you. It is a specific plan for you. It's your specific pricing, so reach out to her. Go to teamfitwithme.com, reach out to Sarah, ask some questions. You can figure out your budget, you can figure out your plan, and do what works best for you, because that is what she is all about. Now, if you're also trying to figure out what's best for you, especially in the nutrition department, definitely check out Clean Eats in Newport if you're here in Cincinnati. Oh my gosh, I love Clean Eats so much. As we speak, I am cooking a Clean Eats cauliflower crust pizza, because not only do they do them like traditional, like meal prep in the containers, the stuff I've been doing for like a decade, but they also have cauliflower crust pizzas. They have like the big things like family style meals, high protein meals, vegetarian meals, low carb meals. Plus they have the cafe where you can come in and just get like a flatbread or just get a sandwich or a power bowl, like a restaurant. You know what I mean? So like for a place to have that many options, I don't know. I just love them so much, because it is so hard to eat healthy. Even though I've been doing this over a decade now, it's difficult. And so like, I think you have to acknowledge that it's hard, especially if you're busy, which who's not, come on. And you want something convenient, and you want to be able to like hit your goals. You want to feel good about what you're putting into your body. Then check out Clean Eats. Again, they have the frozen section. Go and just grab and go whatever you need. You can do the fresh meal plan. That's what I do every week. I do 21 meals a week. Like this week, what is one of them like? Is like rosemary steak French fries. Yes, please. And I'm doing the cauliflower crust pizza. So just check them out. There's no membership. There's no like, you have to like subscribe to something. You just go get what you need, and that's it. And I guarantee you're just going to keep on coming back. So check out Clean Eats in Newport. They are fantastic. Now let's talk all about mental health with Dr. Shelby Gardner. Thank you so much for listening to the Pound This podcast. I am Amanda Valentine, very excited to chat about the topic of mental health, because I feel like all of us need to have a mental health conversation, but especially after COVID, even though it feels like a million years ago, but yesterday at the same time, I feel like there's just not one human that has not been impacted by any sort of mental health issue. So this conversation, I think, is super necessary. And I asked the listeners to give me some mental health questions. And we have a mental health expert. We have Dr. Shelby Gardner from the Christ Hospital. How are you?
I'm doing great. Thanks so much for having me tonight.
So Dr. Gardner, tell me a little bit about you and your background.
Sure. So I'm a Cincinnati native. I grew up in Lebanon, Ohio. So depending on who you ask, that's Dayton or Cincinnati. I'll count myself as a Cincinnatian. I went to the Ohio State University. So sorry for any listeners that are fans of that state up north. Had to throw that out there. But I did my medical training here at the University of Cincinnati. Went briefly back up to Columbus for my residency, and then I've called Cincinnati home ever since. I've been with the Christ Hospital Network for about 6 months now. I'm absolutely loving it. It's been a really wonderful place to take care of my patients. I'm a primary care physician, so I get to take care of all different kinds of conditions and all sorts of different ages. So I have little tiny babies to older adults, and I get to see the whole family.
That's awesome.
In all of my spare time, I have a 1-year-old puppy, Champ. She's crazy. She's an Australian Shepherd. And then my husband and I like to enjoy, Cincinnati food and sports, which is really really going strong.
Right?
now.
I would say this is a good time to be a Cincinnati sports fan. Like the
It
first
sure
time in
is.
forever.
I know. It's been good.
So how often do you have the topic of mental health come up in your daily practice?
It's every day. It is every single day, probably multiple times a day. Like you were saying, I think, this was a conversation that was accelerating even before the pandemic. We were starting to be much more approachable in the medical community about these conditions and encouraging our patients to bring them to us and say, how can we help? What can we do to get you in a better place? And then the pandemic happened along with a lot of other stuff that's kind of going on in the world right now. And I think for all the things that have happened that have been sad or scary or stressful or hard, that's been one of the positives that came out of the pandemic, is that we were able to put more resources into this and realize that it's important and it touches all of us. And so for better or for worse, it's something I get to help people with every day.
That's awesome. So before I get into some of the specific questions that were asked, like what do you see on a daily basis is like what most people are struggling with?
There's the everyday life stressors. So that's not a clinical diagnosis, but I think in primary care, we get to see the great things that happen to people and happen for people, but we also hear a lot of the day-to-day things. The job is stressful, family health issues, finances, whatever, it's there. But then it can also progress to more common clinical problems like anxiety or depression. Those would probably be the two bigger ones. But we also help take care of patients that have PTSD. So that's post-traumatic stress disorder, schizophrenia, bipolar disorder, kind of a variance of different things, but probably anxiety and depression are the two biggest ones. I would also include probably substance use disorders, so people that have troubles with alcohol or other substance use.
Okay. Well, speaking of that, I know for me in the heat of the pandemic in 2020, I was just having a really hard time and struggling. And I met with my primary care physician at the Christ Hospital, and we had discussions about what I was going through, which was so different than just like being sad and bummed out. It was like, it felt like the color of life had been drained. Like it just felt like I couldn't find any joy in the small things. And that's usually like exactly how I am, where I'm like, ooh, this lemon water turned out perfect. Hooray. Let's throw a parade. And it was just like, just everything was gray. And I'm like, I don't know how to deal with this. And so I did briefly, I went on antidepressants. I went on medication because that through the conversation with my primary care of like, I don't know how to deal with this. Like this is every day and I can't pull myself out of this. Which was incredibly helpful for me in working through all of that. But that kind of leads me into the first question we got from listeners, which was, what are some more natural, holistic alternatives to antidepressants and medication? So maybe, like for me, I was like, I need this medication right now, and that's great. But for me personally, I don't want to depend on that. I wanted to find a way of like, I know I need this right now, but how do I find a more natural, holistic way to deal with this once I kind of get back on my feet a little bit?
Right. And I'm, first of all, really glad that you went and you asked somebody for help and said, hey, this doesn't seem like me and I need some support here. And that's probably one of the things I want people to take out of this conversation is that it's okay. You don't have to suffer in silence, that you're not on your own. You're not going through this alone. So let me talk about some things maybe you can try at home, or you can try with friends and family first, and then later on we can kind of get into what options there are that from a medical standpoint I could help you out with. But for all of my patients across the board, and this probably shouldn't come as a shock coming from a primary care doctor, I preach basically, I would say probably 4 things. So the first big thing that you can do from a more natural or holistic perspective is make sure you're feeding your body the right foods. Like, give yourself good nutrition. And so I don't always mean, I think people think I mean like it's always got to be healthy stuff, right? It's got to be the apple to keep your doctor away. It's got to be the granola crunchy, that kind of stuff. But really what I mean by that is that for most days, most meals, get good nutrition, plants, veggies, seeds, nuts, legumes, lean meats, that kind of stuff. And it's okay if you have a hamburger on the 4th of July, right? It's okay if your mom says, hey, you had a really rough week. I made this favorite meal that you really love, and I'm going to bring some over. It's all in moderation. So that's good for your soul too, right? So you need the healthy nutrition, but it's okay to do some of these other things that we really enjoy and that we really love in moderation. Maybe not have the hamburger for every meal every day, but the little things like that are important for you too. So nutrition is really important. And the second thing I would probably preach is exercise. I think one of the listeners submitted a question specifically about this, so we could get into it some more later. But, even just a little bit of activity every day, even 10, 15 minutes has been shown to help people with their mood. The goal would be about 30 minutes, 5 times per week, but you can ease into that, right? You don't have to go run the Queen City Marathon next week and say, this is the only thing that's going to fix my anxiety or my depression. But a little bit of movement in your day does help boost natural endorphins. They're actually, it's like cannabis-like endorphins, so they're called cannabinoids. They're naturally occurring hormones that we have, and they help boost our happy hormones. So getting a little bit of movement in your day, getting good sleep. Nobody's going to feel good if you're running on fumes, right? That's not always the easiest thing to do because a lot of mental health conditions like depression or anxiety, PTSD, things like that interfere with your sleep. But where you can, set yourself up for success. Don't binge watch the Netflix show and then expect to fall asleep, or have a couple of beers and then try to go to bed. It's probably not going to help set you up for success. And then the last thing that I try to get my patients to at least try is something called mindfulness. So it's a much more nuanced concept than I can explain here. I'm not very articulate when it comes to explaining it, but it's essentially the art of recognizing your emotions in yourself and getting in touch with those before they spiral out of control. So say I'm starting to feel a little bit anxious because we're on a podcast. I've never done this before. And so my mind just starts going about things. But if I can take a breath, say I'm feeling anxious, it's going to be okay. It's going to be a new experience. Maybe I'll get to reach some new people and get them to feel like they're not alone in all this and be in touch with that. Then it helps me to calm down. There's some other techniques like breathing, and some people use like fidgets and stuff like that to really connect their breath work. But those are things that I try to get my patients to think about first. So good nutrition, good sleep, move your body, check in with yourself and see how things are going. And those are kind of the foundation, even if we end up talking about medications or counseling later.
Yeah, no, those are awesome. And I'm going to kind of jump on your mindfulness there, because I've done so much work and all of that for myself. And one of them is for me is to, like, exactly what you're saying is like feel my feelings. And so I feel like it's that because my natural reaction is I want to numb it out. So it's like, oh, I want to eat something, or again, like talk about like, I want to get a drink, or I need to go scroll on my phone, or I need to do something other than just feeling this feeling that feels yucky. And I have found that like once I just sit with it for a minute and just let myself feel it, it'll pass and it'll go away in a couple minutes, versus just letting it boil inside of me and then find all of these distractions and then make it like worse and worse and worse. So it's like, it's hard in that moment to like sit there and sit and feel these yucky feelings, but it's so much better that if you just feel it and then let it go.
Yeah, for sure. And that's one of the things I tell people is that I can sit here and say this all day long, that eat the right food, get lots of sleep. And it sounds easy, but it's honestly probably one of the harder things in life to do, is to recognize that this is important and make the time and make the effort and get people on board with it too, that these are not changes that happen overnight, but they might be enough to help with life stress, but even, mild depression, mild anxiety, things like that.
Yeah. So on to our next question. What is the effectiveness of CBD for mental health issues?
That's a great question. It's definitely a hot button topic right now. So when it comes to CBD, that's actually it's going back to those cannabinoids that I was telling you about. So cannabis-like products. And so it's part of the plant that it comes. Let me back up. So trying to figure out how to explain this. So CBD is derived from hemp plants, and in its pure form is not psychoactive, meaning it does not cause sort of the euphoric, calm down type hallucinogenic properties that we would see with something like THC, which is also a cannabinoid that you get from marijuana that causes people to have a high. Unfortunately, in the United States, we don't have a way to really get a lot of data on this or study it because of the way that the federal government studies controlled substances. So right now, there's not a lot of studies to say whether or not it's effective and at what dose and how much and those kinds of things, like we would have studies, say, for medications that you might be more familiar with, like Zoloft or those kinds of things. They just go through different regulatory processes. So right now, CBD products are all the rage, but there's no standard monitoring or protocols for those. And so I don't have a way to say this product has this much efficacy or has this much ability to control your symptoms because of that monitoring process, which is kind of a hindrance because, some people do say that it helps them with their symptoms, but from a clinical standpoint, I don't have a way to say this is the dose or how to do that safely. So I generally encourage my patients that if you're thinking about starting something for anxiety or depression, let's talk about what we have safety measures in place for so that I know exactly what you're getting and what side effects you might experience from it.
Yeah. And what I have found interesting, I got in a conversation last week with some of my coworkers about CBD and how it affects some of us, but not others. Like I've tried like the CBD seltzer and the little tincture and even like the salve, like after going for a run, like putting it on my feet, zero. It does nothing for me, like at all. And other coworkers of mine are like, oh, if I drank one of those seltzers, I would fall asleep. I'd be so relaxed. I melt into the couch. I'm like, oh, it's so interesting how it works for you. We can do the same exact thing, but it like just doesn't affect, I don't know if that's like the difference in body chemistry or what.
It's probably a combination of all people are built differently, for better or for worse. We're not cars, and I can't like plug us in and say, oh, the carburetor is broken. That's the issue. But I think, part of it too is that there's no standard way to produce these products. And so there are impurities and there are slight variations. So some people might react very differently than others. And that could even just be the product itself has variance within it.
Yeah. And that does seem kind of scary if this is something that you're looking for to help you. And it's like how much experimentation of stuff that you have no idea what you're putting in your body and what's going on.
Yeah, it's a little bit, I caution my patients to at least be aware that they're not FDA approved products. So everything down to the marketing on the label doesn't really have to meet any standard safety or efficacy protocols, meaning that it actually works or doesn't create harm. It's kind of the same vein as like herbal supplements or vitamins. Some people might use St. John's wort is a pretty popular like herbal remedy for anxiety and depression. It does actually help very mild symptoms of depression, but the reason I don't go to it as my first line for my patients is because it's not cleared or proven safe by any regulatory body. So I can't say for sure what it is you're getting in those containers. The other thing is that medication interacts with a lot of different stuff, which could be true for things that are purchased over the counter. So just something to be mindful of. And if you do think about starting it, I would bring that up to your doctor or your nurse practitioner and say, hey, does this interact with anything else I'm taking, just so you're being safe?
Well, a question on my own here. I've never taken St. John's wort, but I do definitely feel a difference in mood if I take a vitamin D supplement in the morning. Is that something that you would recommend?
That is a great question. There's so much debate right now in the medical community about vitamin D that we do think that it has something to do with depression, but we can't quite figure out, is it a correlation or is it a causation thing? Because we find, especially here in the Midwest, where we don't live in sunny California, right? We have a hard time saying, do people with depression or anxiety have a lower vitamin D level, or is it just that we happen to catch this and find, oh, this person had a low vitamin D level, but it's not necessarily causing it. But then you talk to people like yourself that they take it and they feel better. So it's a very hot topic. I don't have the final answer on that. I think the jury is still out. It's probably safe to take. Just make sure you're not taking more than the recommended amount that's on the back of the bottle. It'll tell you how many units to take per day.
Yeah, I've taken that and B12, and I feel like both of those, like I feel a difference, especially like on the cloudy bummer days.
Yeah,
those definitely help. They help me anyway.
Yeah, both the vitamin D and the B12 have been associated with mental health conditions, but we're still trying to figure out if maybe that's a good route for the medical community to take for treatment.
Okay, awesome. Well, speaking of things of like, you don't really know, like going back to the CBD of like, oh, what am I getting? Is this good or not? The next question I have is, how accurate is advice or self-assessment tests on the internet? So like, obviously you're going to put into Google, like, how do I help my mental health issue? You're going to get all sorts of answers. So how much should you trust some of that?
It really varies. So it depends on the tool and where you're getting the screening tool from. You can find all sorts of self-help gurus that have come up with their own screening and diagnostic materials. But if someone is looking for kind of a good screener, the same one that we actually would use in your primary care doctor's office. So the one that I would probably look into or ask your doctor about for depression is something called a Patient Health Questionnaire 9, or PHQ-9 is the acronym for it. It's actually how we diagnose depression in the office. And so the first couple of questions, for example, it'll ask you, are you feeling down? Are you feeling depressed? And then the second thing it asks you is, how's your interest in stuff? So you mentioned, it was actually a really sad but beautiful description, is like the color kind of came out of life. Like, are you still enjoying the things you really, really love? And those two questions are pretty sensitive for depression. So if you have a positive test or a positive answer on one of those, then it asks you a few more questions. So if someone's looking to say like, hey, maybe I want to look into this a little bit first, that would be one that I'd reach out to and look into for depression. For the anxiety, there's something called a Generalized Anxiety Disorder 7, or a GAD-7. It's sort of a similar screening questionnaire. So, there's really good ones out there. There's a lot of different options, and it varies by age and are you a teenager, or are you an older adult, those kinds of things. But those would probably be the two I'd encourage people to take a peek at if they're curious of finding one online.
Okay. Well, and then speaking of online, the next question is telehealth more or less effective for mental health issues? And I think this was kind of specific to, if I was going to meet with you and I was going to have this conversation, is it different that if we're virtually through a screen and I'm trying to explain to you how I'm feeling, or is it better if we're actually sitting face to face?
I think that's a fabulous question. And the pandemic really brought this out because, yes, we were doing some telehealth or video visit conferencing a little bit before the pandemic, but now it's much, much more accessible. Insurance companies are covering it. And now there's even entirely virtual counseling options available out there on the internet. For mild symptoms, they've started to do studies. So mild anxiety, mild depression, we find that for some people, it's just as effective as doing an in-person interview or an in-person meeting to talk about symptoms and next steps. I think just from a practical standpoint, if somebody feels more comfortable coming in and talking about their symptoms when they're able to be in their own home, they're in their own environment, I'd rather them do that than never come in because they're worried about, the experience of, I've got to talk to a receptionist, I've got to make the appointment, I've got to take my vitals, whatever might be stressful for them or triggering for them. I would rather there be an option. So if the option is do the video visit versus coming to see a doctor, then that's obviously going to be more effective than nothing. And that would be kind of my practical sense on that. There's going to be more studies coming out. I know that there's several in the works right now. And I know the VA is doing several large studies, especially on like PTSD and video visits, those kinds of things. So it's the modality that's going to get you help, going to get you to the person that can help you feel better. That's going to be the most important.
Yeah, I don't know if you know the answer to this, but I'm just kind of curious of like, do you know if more people have gotten help because they have a virtual visit, because it kind of takes some of that fear out of that, out of it just feels like when you tell somebody like go talk to somebody about mental health or see a therapist or a counselor, it feels like, I don't know, at least pre-COVID, it felt like there was way more of, I guess, a wall put up between that of just like, I'm fine. I don't need to talk to someone, where I feel like post-COVID, I feel like that softened a little bit. So I'm curious, not only through the pandemic, but because of telehealth, has that given people more incentive to actually discuss things? But I don't know if there's even any research or any numbers on that.
I know there has been, I don't have exact numbers for you, but just in day-to-day practice, I come across people that say, I wasn't sure I wanted to come to a doctor's office, but I found this counselor online, or, my employer started offering a few sessions per year because of the pandemic and realized a lot of their employees were having a hard time coming back or coping with losses or being isolated at home. So it's become a much more accessible realm of healthcare to be able to talk about our mental wellness and how we're doing. I know even just in the medical community itself, we really struggled through the pandemic. It was hard, and there are factors that are still really hard. But even just within our own, communities of physical therapists, doctors, nurses, everybody, it's been much more accessible. So I wish I had an exact number for you, but I know that it's been one of the few blessings that came out of the pandemic, was the ability to talk about it honestly and get more access. There's still not enough. There's not enough people out there with the training we need, but it's more.
Yeah. And I will just say, just as a note for myself to throw this in there for anybody that may be listening that might, be against any sort of talk therapy or discussing this with somebody, that like for me, I started therapy in 2020, but that was just because of like job timing and stuff like that. So it really had nothing to do with like the pandemic. I started right before the pandemic. So it was, all of my therapy at first was like telehealth. And for me, just hearing myself say the stuff out loud that was in my head made such a different connection to me and helped me sort through things so much like easier and really work through them. Like that was just such a game changer for me, where it's like, I don't know, it's different when it stays in your head, but then the moment that you hear it and you see somebody else like listening to like what the thoughts you've been hearing, you're like, oh wow, if I heard somebody else say that out loud, this is how I would react to it. But I don't have that reaction when I'm just saying it in my head. And I don't know, I feel like stuff like that has just is really eye-opening. I'm not sure if you have that experience or not, being a doctor, or and have people have that same reaction. But I just think it's so important. If telehealth is the way to do it, then just to hear yourself say it out loud, I think is incredibly powerful.
Yeah, I would agree. And that's like, I don't know that I would classify it as a more natural or holistic means to treating some of these issues, but there aren't the side effects, if you want to think of it that way, when you do talk therapy, or the fancy word we use for it is cognitive behavioral therapy, CBT, that has the most evidence for anxiety and depression. It's really just your time. And there's obviously a financial cost to it as well. But I think a lot of people think it's this, lay back on a couch and tell me about your childhood, and you just kind of talk into a void, right? But if somebody is skilled and they're really doing it right, what they do is they hear how you experience the world and how your past experiences are informing what you're thinking now. And they reflect that back to you. They say, all right, here's how you just explain this to me. And like you said, you kind of realize, oh, this is how I'm seeing this situation, or this is how I'm experiencing this problem. And maybe that's not going to help me get to where I want to go emotionally, and they give you then the tools of how to get to that next step. So it's hard work, but I think it's really worth it for a lot of people.
Yeah, I definitely agree. The next question I have is, so at what point does somebody ask for help? At what point where are they being like, oh, I can just figure this out on my own, or I'm gonna make a TikTok about it and then read the comments and it's gonna answer my problem? Like, at what point do you're like, I should reach out to a doctor?
Yeah. What I tell my patients is there's a fine line between personality and having like an anxiety or depression disorder. I keep going to those because they're just what we see most often, but having a mental health condition. And so, for example, I would call myself out and say, I'm a high strung person. I tell my patients this, I like to know what's going to happen. Why are we doing it? What are the consequences? I just need to know all the details of it. And that helps me plan and prepare, right? But the difference between being a high strung or a type A personality and, say, having an anxiety disorder is that ability to turn it off. So if it's not the time to be thinking about 1,000 consequences down the road, it's the time to be enjoying a meal with my family, or it's a time to be on a walk with my dog. But I'm constantly thinking about all these other things that I've got to do, and it's interfering with my life. That's really the key, is when it's interfering with the person you want to be, the things you got to get done. So for a lot of people, they kind of pull back on their social connections, or they might not be as engaged with their kids when they come home from work and they're a little bit more irritable. It's really that function piece that you're not doing the things that you want to do the way you want to do them anymore. And it doesn't seem to be getting better when you try to work on things like, I changed my diet, I made sure I got enough sleep, and I'm still feeling like this is not who I want to be. That's when I would encourage people to reach out. Certainly if it escalated beyond that and you were having thoughts of harming yourself, harming anybody else, then certainly reach out. Please, there's some resources I can give for that. You can always call your doctor's office, but it doesn't have to get to that point. It's whenever you start to notice like, hey, I'm not the person I want to be, and this doesn't seem just to be I'm having a rainy day.
Yeah. And I think too, I mean, not to speak on behalf of all people, but I feel like there's also with things like that, there's fear of judgment. But I feel like if you're feeling these things and you just realize your doctor is not going to judge you, they're there to help you. It's not like you're, again, like making a Facebook post for random strangers on the internet to put their opinions on there. Like, that's what a doctor is there for, to share these thoughts without judgment and just to be there for you.
For sure. Yeah. And, the current estimates are that 1 in 8 people have some sort of mental health condition. And so by all means, you are not alone if you're having those thoughts. And I think, like you said earlier, kind of getting that off your chest and saying, hey, I'm struggling a little bit, can be really therapeutic for people, even if it's just the first step and you go home and you think about what the different options could be. At least you heard them. At least you went over, this is what we could try.
Yeah. Well, completely changing gears a little bit here. Another question we have is, does perimenopause affect anxiety levels?
Yes. The answer to that is yes. Yeah. People that identify as women that get to go through the lovely life changes that we do through puberty. And if you can think back to that, and hormones are going all over the place, and teenagers don't always regulate their emotions the best, going through another very, very dramatic hormonal change later in life can do the same thing. So again, if you're concerned that might be something going on, please reach out, because sometimes it's just, hey, life's kind of crazy. And sometimes it might be perimenopause or menopause that's making you irritable and cranky and tearful and you can't sleep and the whole 9 yards. So unfortunately, the answer to that is yes.
So typically, and this I'm asking for me, what age range does that happen in?
A really good predictor, actually, or a fairly good predictor, is that if you had women in your family go through menopause around a standard age, so in the US, the average age is 52, but say all the women in your family went through menopause at 49 or 50, and you start to notice, like, I'm getting some hot flashes, my periods are getting a little wonky, things like that, that might be perimenopause. But, anywhere from 45 to mid 50s is pretty typical. The standard is 52.
Okay.
I say standard, the most common.
Okay. Well, it's hard for me too, because like the women in my family all had hysterectomies. So I'm like, I don't know what age.
Yeah.
Like, I don't know how to gauge this, but I'm going to be 41 in oh God, in like a month. So that's where I'm like, oh, I know that the average is a little bit later, but then you hear stories too of women going through this stuff in like their late 30s. And I'm like, oh no, like how am I going to know? I feel like I'm getting in that age range now. I'm in that like the box is getting longer down the list of my age. And I'm like, okay, so when am I going to start feeling this stuff? And how am I going to know what it is? You know what I mean? So I feel like that's my own paranoia and anxiety of how am I going to know just that I'm not PMS-y, but I'm menopausal, and how am I going to deal with that? I don't know. I don't know how I'm going to handle this.
I think you will get through it beautifully. Happy early birthday, by the way.
Oh, thank you. But yeah, I think it's just like, I don't know. It's just like one of those things, at least for me, where, I turned 40 last year and I was like, oh, it's time to get a mammogram now. And I'm like, oh,
Yep.
And then like, okay, so here come mammograms, and then here comes menopause, and like, and I don't know. I think culturally you just hear like these nightmare stories about it, but like, I don't know what it's actually like to like, what symptoms to experience. So I guess that's where I'm like, again, I'm asking a doctor versus like, I'm just going to Google it and freak myself out. So I guess that would also let me play into a question of ask your doctor of like realistic things instead of like Googling it and then freaking out.
Yeah, no, don't freak out. I'd say probably the big things would be like your periods are changing. So usually it's getting lighter and less frequent, but the opposite can also happen sometimes. So period changes. Yeah, I know. Isn't that fun? Period changes, the classic like night sweats or hot flashes. So feeling suddenly very flushed or warm when everyone else around you is like, no, it's fine. It's great outside. Mood issues and some sleep issues. Those tend to be the big ones. But if you've ever have a concern about it, you can always reach out to your primary care, or obviously a gynecologist would be able to handle that.
Yeah, I just gotta throw this out, man. Just hormones just beat us up our whole life.
They sure do. They just love to put us through the ringer.
Right? Man, I can't even imagine what my life would be like if I didn't have to deal with that. Be like so pleasant. And then you mentioned this earlier, and the last question I have from a listener is, how much does exercise affect your mental health?
This has been a really fun topic lately that we've seen coming out in different articles, different organizations trying to look into this, because exercise is great all the way around, right? It's going to be good for your mental health, but it's also good for your bones. It's good for your gut. Like we're learning that humans are meant to eat good food, and they're meant to walk around and be mobile. Those are a couple of things that here in the States we don't do the greatest at all the time. But in an effort to try to see what else we can do to help people with their mental wellness, that's something we've looked at more closely. And actually, if you have mild depressive symptoms or mild anxiety symptoms, they've done some studies suggesting that exercise might be able to compete with, or at least get kind of close to using medications or counseling. And that's for people that have mild symptoms. Obviously, if you're really, really struggling, then we need to add some other treatment options in there for you too. That I'm by no means saying, go for a walk around the block and that will fix your depression. But if it's very mild, it's something we can add into your toolkit to try to get you to feel a little bit better. The current guidelines are saying somewhere between 3 to 5 times a week, get about a half an hour of exercise. And so I tell my patients, I don't care how you do that. If you are a runner, great, go for a run. If you're somebody that you like to take your dog to the dog park and you guys are running back and forth chasing the tennis ball, go for it. If you've got kids you're chasing, that works too. Whatever is going to get your heart rate up, that'll be some time that you can connect with others. So there's the social piece of it, which can be really helpful for mental health conditions. It'll help gain some confidence if you feel like, I've got muscle tone, I feel good in how my body is. That's part of it for a lot of people, especially women. And you mentioned going through like the menopausal, perimenopausal change. That's a big time when women start to see changes in their body composition, and they worry like, hey, maybe I don't feel the same in my own skin as I used to. So there's a lot of benefits to it, not just the cardiovascular and direct mental health of the releasing the endorphins, but there's the social and things like that too that factors in.
And do you have any thoughts on how exercising in nature affects mental health?
We love nature. Nature is so good for you. It'll get you a little bit of that vitamin D. Just wear your sunscreen. You'll be outdoors getting some green air. You'll be getting some fresh air. You'll be out in the green things. We know that is good for you, especially if you want to grab a friend and go with that too, that piece really keeps you grounded and it helps bring perspective into difficult situations.
Awesome. So if somebody is listening to this and they're like, this is great, I want Dr. Gardner to be my primary care physician. Are you accepting new patients? Are you available for questions?
Yeah, I sure am. So I currently work out of the Fort Wright office there in Northern Kentucky. So it's about, 20 minutes-ish from downtown, if that. But I am accepting new patients and I would love to help. And I can certainly get you my contact information too if people have follow-up questions.
Great. Well, thank you so much for your time. This was so helpful.
Perfect. I'm so glad.
AmandaValentineBites.com